them again. Thank you once again for gracing this media briefing with your presence and your attendance. This provides us with a great opportunity to keep the people of the province of KwaZulu Natal in South Africa abreast of the latest development regarding the COVID-19 pandemic. As you are all aware, this COVID-19 has changed life and is affecting every sector of the society. The Provincial Executive Council met this morning and received the reports from various departments on various matters pertaining to our response to the COVID-19. The first is academic recovery plan. The Executive Council received a report from the Department of Education on various options to be explored to mitigate the impact of COVID-19 on the education sector. This presentation is part of the proactive approach by the department as we still await further announcement in terms of the lockdown. We are aware that a lot of scientific and medical assessment is being done by national government, and we will hear from the President in due course regarding the national lockdown situation. Our proactive plan through the Department of Education seeks to explore options in the event of lifting of the lockdown period or a possible extension. The plan explores a possible of adopting a potential boarding schools approach for those learners and teachers doing grade 12 and various programs for grades below that. We must emphasize that it is a holistic proposal with all risk analyzed and mitigated. Currently, the department is conducting a recovery plan via mass media and other platforms. The detailed plan will also entail precautions in the event of a possible extended lockdown, and that will include ensuring that we focus more on a matric. The department has also been asked to discuss the plan with the national government, the stakeholders such as parents, organized labor, and all governing bodies, school governing bodies. We must emphasize that this is a proactive planning which is subject to getting a buy-in from our national government. It should be remembered that KwaZulu Natal is the largest number of learners compared to other provinces. In the meantime, we are also ramping up the existing education program on various media platforms. And we must indicate on this note that the department is consulting, but we don't foresee the province having any substantive holidays should we start after this lockdown. From June, I think we will be working, education will be working in full force, and during September period. So the MEC is finalizing modalities on that recovery, and it is a plan that is going to be very intense. With regard to the investigation into the alleged irregularities in the purchase of blankets by the Department of Social Development, as the Executive Council, we received the report arising from the media, a report on the alleged irregularities in the procurement of blankets by the Department of Social Development. These blankets are being distributed to various shelters for the homeless people during this current phase of the lockdown. The Provincial Executive Council has resolved that the Provincial Treasury be mandated to institute an investigation into this matter. And why we want to investigate it? It is because it is one of those things that are worrying us. The amount involved and issues raised are a worry to us. And that's why we've said, let us have an independent investigation on the matter. Because for us, if we've got disaster, it doesn't mean that we must take disaster as some form of a business or something for others to benefit themselves. We're going to ensure that we conduct this investigation independently, and that's why we've said Treasury must have a full-time investigation on this matter. With regard to the development at St. Augustine Hospital, as announced by Health Minister, Honorable Dr. Zweli Mkhize, yesterday, 66 people have tested positive for COVID-19 at St. Augustine Hospital in Durban. Of these, 48 are staff members and the rest are patients. This is an extremely concerning development, and we have asked for detailed examination of how cases were being managed at the hospital. At this point in time, we are responding to the developing crisis, and we are not as yet sitting in a judgment. We don't want to conclude. We are looking and still observing what happened, and we've said that let there be further investigation on the matter. Out of 1,982 staff at Net Care St. Augustine's, and out of these, 735, which is 37%, are permanent employees. And we have established that at least 112 staff members have been tested at the hospital. These include nurses, cleaners, and administrative personnel. There are currently 74 patients still in that facility. As of last week, St. Augustine Hospital has stopped taking in new patients as per the directive that we issued to them. Patients are being discharged or moved to other facilities. All those in the facilities are currently being tested in preparation for the next move regarding this hospital, which will come from either the Minister of Health or the MEC. We are in consultation in dealing with this matter, but clearly everything must be done to save those people. We are determined that all patients will be moved to another hospital, and as well as all of those who are already positive. So we need to ensure that there is a plan to deal with this situation. The management of the Netcare is currently undertaking a symptomatic checklist of all staff to assist with appropriate screening process. From the pilot of home screening and testing program that was held in Umlazi, a total of 118 households were visited. 502 people were screened, and 17 people were tested for coronavirus. And I must say that when we screen, you screen many people, but from screening, you then identify those who need to go further for testing. So you don't just test everyone. Even in a household, you will screen and see who has a potential to have been infected. And then based on that, you test based on that. So 17 people were tested last week in Umlazi. With regard to the PPEs, we've also noted the disgruntlement over the unavailability of the protective personal equipment. Complaints have come through from both our healthcare workers, but also from the organized labor. We want to clarify that due to high demand globally, there is a shortage of PPEs, particularly the N95 masks that are only manufactured in China in particular. That said, we want to assure both our healthcare professionals and our organized labor that we're doing all in our hands to ensure that they get supply, and the department is in touch with various suppliers to secure more on top of what is there. We are the first to acknowledge our responsibility to protect healthcare workers from getting infected with COVID-19. And in that regard, we will continue to do everything in our power to ensure that all those who require these masks get them. I must also conclude on this point by thanking all our doctors, healthcare workers, the social workers, the police, members of the SANDF, and even our officials in municipalities and departments. So far, we've seen maximum cooperation. We've seen a great level of dedication, especially from healthcare workers and from our social workers who go an extra mile to look after homeless people in various shelters, and we want to thank all of them. On behalf of the people of KwaZulu Natal and on behalf of our government, we thank the police, we thank healthcare workers and the doctors for the work they've done so far. We commend them for their dedication. Some have even gone to an extent of working extra hours, and we value that, we take it to heart. With regard to the work of the Executive Council, KwaZulu Natal Executive Council today received a detailed briefing, a report on the state of municipalities which have been under Section 139B. With this report, 9 of the municipalities were placed under Section 139B, and one of that, which is Endumeni, was we concluded that it had got stabilized, and we're happy with that. We have resolved to extend our intervention in Richmond, Umzinyathi, Mtubatuba, Umsunduzi, Inkosi Ilanga Libalele, Mpofana, Abakulusi local municipalities, and at Utukela district municipality. So the 8th will remain under the administration. The Executive Council believes that the extended municipal intervention will allow for consequence management measures to be implemented effectively. So that will include implementing number of forensic investigations, which, if we leave, will not be fairly implemented. And that's why we are saying we will continue with that. But on top of that, there are still a number of investigations that are going on. And there are also some interventions in terms of the capacity of the municipalities. We are quite impressed with the improvement with regard to Umsunduze municipality. We have already received a report which indicates that there is improvement. In Umsunduze, they are starting working on filling the vacancies at a senior management level. As you might have heard, they filled the post of the MM, and they are working on that. They are also starting now to deal with the issue of ensuring the systems are in place with the support of the provincial government, especially the MEC champion who is assigned to work in the district of Umkungundlovu. We have established the war room that seeks to ensure that the administrative capacity of Umsunduze is improved, and also ensure that we fast track the implementation of all projects of service delivery that are in that area. The intention is to ensure full accountability and for standard procedures to be followed as a norm in all our municipalities. So we want to assure you that while we are seized with challenges of the lockdown and COVID-19, we have not neglected our responsibility to provide direction on issues of governance and on issues of service delivery in KwaZulu Natal. I thank you.
Thank you very much, Honorable Premier. We all know the protocol. You will take questions now. You will say your name, the medium you're coming from, and your question. Can I see the... Okay, 1, 2, are you covered? 3, 4, 5. So we'll start with that number.
Okay, my name is Augustine Hospital. I have just one question for the Premier, and then 3 for the NEC for health. Just Premier, this regards the intervention that you are supporting indigent people area. So earlier I was around the Durban CBD and I started speaking with NGOs which are supporting homeless people. Now what they're saying is that many people who previously could afford rent, who could afford to stay shelters are now not able to because they're not able to get money, peace jobs to actually pay for that. So I'm just asking, can you just help the public understand what plans we have to assist people like that if they are? And then questions for the MEC for help. The first one is that organizations that are running campaigns, particularly in the city of eThekwini, that are placed at homeless shelters, they're saying that they're not getting support from the Department of Health. Practically, they're saying they're not getting ARV and TB medication being sent to them despite calls that have been made to them. So they're also saying that people who are homeless and who are even pregnant or have other illnesses are being turned away from hospitals such as King Dinizulu, King Edward, Eddington hospitals. Are you aware of such instances? And if so, what may lead to people who are homeless not being taken to hospitals? And just last one, you spoke earlier on 702 about the trend of private hospitals not following protocols to test people who are infected with COVID-19. Can you please give us an idea of how many of these hospitals are there and some names if possible? Thank you.
Number two. Three.
In as much as we understand the intervention that have been put in place to expedite the process of acquiring those PPEs, but we currently have a situation where health workers are saying they are being exposed because they don't have that protected here. By when do you expect the provincial government to be able to procure these PPEs? Because at the moment that's what the health practitioners are complaining about.
Thank you.
For Fanele Pyong from SABC Radio News, still only KZN Augustine. Premier said some of the patients moved to other hospitals while some are being discharged. So what I want to understand is with people who are being moved to other hospitals, have they been checked if they are not also, have they been checked if they are not going to move with the virus to other hospitals?
Okay. I'm Jonathan Erasmus. I'm here for Daily Maverick today. Just a quick thing, the nurses that were tested at St. Augustine's, I gather some of them were, this is probably for the NEC, this particular question, that some of the nurses were from other hospitals and doing training at St. Augustine's. Could we get any kind of details if that's obviously true and what hospitals they may have been from? My second question is to do with this issue with the Department of Social Development. Would the executive be prepared to kind of put out a statement that all procurement that is done during this time will be made public in order for greater transparency? And lastly, with Umsunduzi, it just clarified, I thought Umsunduzi was still under Section 189 intervention, but I didn't hear you mention that, so just clarification of that. Thank you very much.
Thank you very much.
No, I will start because number of questions will be answered by MEC Nomakuku Smilanizul. So I will just deal with few questions. The first one, yes, Umsunduzi is still under administration and it was extended. They are still going to be under administration, Section 139B, and that will be a process. Procurement on social development. Look, it's not the time of, when it's time to do everything anyhow. No. The fact that there is a challenge does not mean that we must allow people to behave and conduct themselves in a manner that is untoward compromising systems. We're not going to allow that. And that's why we are now saying all procurement must be checked also with treasury, so that we are ensuring that there are balance and checks in place. We must check everything that is happening. I think those are two main questions, because it will be good to allow MEC to deal with issues that belongs to the line function, and MEC Smelane Zulu will deal with all other questions.
Good afternoon, ladies and gentlemen. I will indeed be responding to a number of issues. Let me start with the question that Nkoskhona indicated in relation to medication being provided to homeless shelters and the NPOs and NGOs that are operating there. I must indeed indicate that ARVs and TB medication is not something that we would issue out anyhow. Now, those NGOs and NPOs that are operating within the health sector would have to be recognized, would have to be given authority to actually dispense medication, and it's only on those bases that they would then be given medication. So if there are new NGOs that are suddenly feeling that it's necessary for them to operate and get this medication, they will then have to go through the proper protocols. There are reasons why that medication is not be given out anyhow, because medication is separated according to schedules. And in terms of dispensing, there are those that have authority to dispense and those that do not. So you will need to be registered for you to do so. And I don't really know the circumstances around the issue that we are raising, but I'm saying if NGOs feel that now suddenly they are faced with a situation where homeless people, they need to assist, they then need to go to the Department of Health. We have hospitals that are there to provide that kind of capacity, but if they don't get that kind of help, they then can go to the district director of eThekwini or go directly to the office of the head of department in KwaZulu Natal, because in any case, that is the person responsible with identifying and recognizing the NGOs that would work with the department. So that is the suggestion I would give to the NGOs. In terms of homeless people being turned away from our facilities, I am not aware of that at this particular instance. However, if you give us a particular case, we can then investigate it and follow it up. However, I must indicate that about a week or so ago, when we started, or when government started putting together or taking the homeless people from eThekwini in particular into shelters, there were a number of instances where those that are, or some that are homeless, were beginning to experience withdrawal symptoms as a result of them not being able to access some of the drugs that they get on the streets. And as a result, that then inundated the one hospital that we have in town, and the hospital itself was not able to actually cope over one night, and then we needed to come back because that was over a weekend, and on Monday we were able to then realize that we have a challenge, and we were able to put processes in place. So that is just the one area where I think the one time where we had a challenge, because we were not prepared for actually the number of people that were coming in and were seen to be having withdrawal symptoms. However, immediately after that, we're then able to put plans in place on what happens when one facility is inundated with numbers, and we're able to share within the different facilities that we have at eThekwini. Other than that, we are not aware, and they should not be turned away, by the way, because all facilities are expected to continue treating our patients as they would, because just because we are dealing with COVID-19 right now, it doesn't mean any of our other illnesses have gone away. They are still there. So facilities are expected to do that, and they are actually doing it. In areas where we are really just dealing with, there's very few hospitals where we've decided it is just dealing with that. For instance, Clearwood Hospital, we've decided that Clearwood Hospital, we are going to be separating it into isolation wards and quarantining wards, and as a result we have moved some of the patients to Wentworth because we also just wanted to make sure that that is what that facility is meant for. However, Clarewood Hospital also has a gateway clinic. We have not closed down the gateway clinic because the gateway clinic is a bit far from all the wards. So the gateway clinic continues to operate. And other than that, there's no other facility that is purely meant for COVID. Therefore, all the hospitals continue to work as they should be working. I did have an interview in the morning, and I did not say there was a trend of private facilities not following protocols, but I did say in this hospital in particular, our investigation, or the investigation so far, has indicated that there might have been that challenge. That is why we have decided that we will continue and then have an in-depth investigation in relation to that, so that we are able to understand what actually happened and what has led this particular facility to have such a number of infections and such a number of deaths, by the way, because of the deaths that come from KwaZulu Natal, 5 of them are linked to this particular hospital, and it is quite concerning. So once we've received a proper investigation as the Department of Health, then we are going to go through the proper legal channels and speak to and follow them. If there is anyone who should be held to account, we will not at any given time hesitate to make sure that people are called to account. But we don't want to jump processes, and we are following. Are we speaking to the management? And I'm now taking all the questions that are relating to St. Augustine. Are we speaking to management? Yes, certainly. The first time when, I think it was early last week, when there was an indication that there was some cases that a cluster of cases that were coming from St. Augustine, we then mandated the head of department to engage with the CEO, not just of the hospital itself, but the CEO of the whole group. And the CEO of the group and the hospital have been in constant engagement with the Department of Health. As a result, we then decided that we are going to close down the hospital. And I think we need to say this. We have closed down the hospital, but we did that in phases. The first thing that we did was to say no patient, as of last week, Wednesday, I believe, was going to be accepted in the hospital. So as of last week, Wednesday, no patient was accepted. However, before we started discharging or removing other patients to other facilities, we needed to test all of them. Because if you want to contain the virus, you then need to know who you have and treat those that are there. And with the treatment and the results that have gradually started or started trickling in, we have been able to remove those patients that are still sick with other illnesses but are not infected with the virus to other facilities. We've been able to, together with the hospital, to discharge those patients that can go home. But we've then now only are left with one ward where only the patients that are positive are going to be kept. They are going to be treated until they are well. By the way, we've also indicated to the hospital that it has a responsibility of quarantining the nurses or the health workers that are there or that were infected within the facility. So that is what we are going to do. And immediately, once everyone is well and has left the facility, we are going to have to quarantine the whole hospital, so that we make sure that after a week or so and it has been quarantined, it is safe again to utilize, and it will be safe once it has been quarantined. And I think it's necessary for us to indicate that. Are we speaking? Okay, let me also just take the question further on whether we've spoken to the CEO. We've also then decided that on Monday we are going to have an engagement with all the CEOs of the private hospitals within the province of KwaZulu Natal. Not because we are picking on them, but because we need to start streamlining the protocols and have a proper way of engaging with each other. HOD currently is busy engaging and planning for that meeting. I know that Monday is Easter Monday and some of them might not be available, but because we will not be meeting in a big room, we will have a virtual meeting, so we should be able to get hold of them. Now, we are going to have that meeting with them. We are going to raise concerns. I must also indicate that there has been a number of concerns that different people in the province have been raising with us in relation to a number of other hospitals. Some are real, some might not be, but we'll be able to get that opportunity to raise the concerns with them on Monday. So I hope that answers that particular question. In St. Augustine, who is being treated there, Well, like I said, we looked at all the patients, we've tested the patients, and we are allowing them to go home as and when our results come in, so that we are sure that we are releasing people who have not been infected and we are able to treat them. Nurses, I think you said nurses. There are nurses that, according to rumor, work, or they work for other hospitals. Look, when we spoke to this particular hospital, we requested a whole list of their employed nurses, which they have provided, but they also indicated that they don't just have full-time nurses, but they also utilize nurses that come through agencies. Now, we have requested that list, and they are going to give us, and well, we've been waiting for about 4 days now or so. But the biggest challenge is that the nurses that come through agencies, you would find that sometimes are nurses that are doing what is called moonlighting, which means they work for government, but sometimes they go and work for the private sector, which is not allowed, by the way. Which is what explains why it's not, this list from the agencies is not so forthcoming, because it means some of them might be nurses that we are paying, but are also being paid by the private sector, and therefore double dipping, and something that is not allowed. So that's in relation to nurses. However, doctors are allowed, should they get permission from their head of department, to operate outside of government if they've been given the authority. That's something that we call RWAPs. So you will also have doctors, some that are operating their private facilities, but also work in private hospitals, but sometimes they also do some work for government, because remember there's an issue of skill here that government needed to start engaging and say, how do we share the skill between the private sector and the public sector? So for you to be able to work on both sides, you need to get authority from the head of department, and often that authority is only given to people with a particular skill and where the skill needs to be shared, because there's not enough of that skill going around. So in relation to that, we can't give you a list now, because we are not aware of who is working for us and also working for the private sector. But as soon as we get the list, I believe we will have a better sense. I think I've responded to all the questions. And there was one. Wentworth, what about it?
We heard this morning that some of the health workers had down tools and were refusing to work, and this was in accordance with the PPEs.
Oh, okay.
Yeah.
All right, yes, there is a question about PPEs, but Wentworth, you are putting through the window. You did not ask that question. Okay, yes. What is the issue with the PPE? I must indicate, and I've said this before, that all the hospitals have their own PPE, which is PPE that is normal according to their daily practice. Now, let me give you an example. When you talk about PPE, there are 3 or so level of masks that we issue. There is a mask that is issued, it's called a surgical mask, or sometimes it's called a 3-ply mask, and I think that's the ordinary mask that most of us would get from time to time. But there are also then masks that are of a higher quality that are called N95 masks. Now, these masks are not always utilized by all health workers at no time. And health workers know this, and they understand that when you work at a particular level of work, for instance, a nurse who will, when I arrive there in a hospital, take my blood, check my BP, will not necessarily need to wear an N95, but will have to wear a surgical mask. And that is the kind of PPE that is being issued, and it has to be issued incrementally, but it also has to be issued according to the area where you work as a healthcare worker. A worker or a healthcare worker that treats an infected patient certainly needs to be geared up and wear a...
All right, and that's where we're going to come out of that briefing that's taking place in KwaZulu Natal with the Premier and the Health MEC talking about the issues in the province. But we go to Geneva now with the